Hi, Dr. Ben Newman here. I am a coronavirus molecular biologist. And I read a lot of coronavirus papers. Let's answer your questions with as much science as I can remember. All right, here we go. Next question is from Amy. Good morning, Amy. All right. Let's see. I just watched Dr. Ben's video on his answers to Mary's questions. All right. I don't remember which one that was, but let's see. Could you ask Dr. Ben what is the way to get rid of COVID-19? Okay, fine. I do remember which one it is. He said something to the effect that some countries are doing it right and some aren't. Yeah, we're in the aren't category here in the U.S. Yeah, others are. I don't know. It's not necessarily one or the other. There's a lot of in between spaces of places that are kind of doing okay and kind of messing up. What's the right way? Yeah, it's the same as it's been since the beginning. All right, so essentially what that would look like at this point with the problem at this level is testing everybody. And you might have to test everybody like once a week for, I don't know, 4, 5, 6 weeks, maybe 2 months. If we can get something like those saliva tests, I just recorded a video about those, working, then that is a way. And once we have that, we need to make sure that anybody that comes up positive. So first, we need to make sure we can get the results to people within a matter of 5, 10 minutes maximum, maybe an hour tops. Yeah, people cannot be waiting for these results because while you're waiting, you're potentially infecting people. You don't know you're positive, and people generally take different precautions. Not everybody, but generally, when they actually know they're infected. Yeah, some people definitely don't. Let's see. Yeah, testing everybody over and over and over again, and then finding a way to actually properly isolate those people to the extent that they can't infect anybody else. For it's going to be 2, or maybe even we err on the safe side, something like 3 weeks. And I don't know, it sounds bad. You're like, don't lock me up for 3 weeks. But 3 weeks of, I don't know if it's going to be TV and ice cream for everybody, but the potential is there. You just got to sort of push the ice cream with a stick, yeah, through the crack in the door, yeah, to the person. It can be done. It'll be annoying and it'll cost some money. But with that, yeah, if you can find all the cases, isolate the cases so they don't spread the virus, then transmission will go down really fast. And I don't know if it would be a month or a month and a half, but yeah, you could knock out the virus in any country. Now, you have to knock out the virus in all the countries for us to actually get out of this, so that would take a little bit of work, and there would be some populations that would be harder to reach and test. Things like the homeless. How do you, yeah, I don't know how you even track everybody down. But there would be ways to get some of them. And yeah, this is kind of a thing where it would have to be everybody working together, like little bees in the hive. Yeah, working together, for each other, and then we could get out of it. That's it. And then once an area is clear, you've kind of got to ring fence that area, and just say, all right, we got to stay inside this area for a little while until we get another area clear, and then once they're actually clear, no more virus, then yeah, fine. Mix amongst those, and then we'll gradually open up area after area until we've got the whole world back. Oh my gosh, yeah. And a lot of people will have had to go to a lot of different countries potentially. There's a lot of travel in there for anybody that really misses travel from the old days. And yeah, it's basically you're talking a force kind of the size of all the militaries in the world. I think that's the size of force they could do it. I don't know that any country would be willing to turn its military over to just eradicating coronavirus. Although at the moment, I would say, what else are you fighting? But yeah, the world is crazy. People are crazy. Yeah, and I'll trust them on that, I guess. But that's the level of effort that's going to be required, and it's totally doable. This is within the realm of things that we understand and can do, and have done similar things before, like during wartime, for example. And it's just the mental will to actually do it and actually follow through with it that is lacking. And it is definitely lacking right now. And yeah, I say this as we're hearing once again about people saying it's no big deal, it's going to go away, it'll disappear after the election. Just all things. Think back at all the other predictions these people have made, that the virus won't be a big deal, that the virus is going to burn out, the virus won't get to America, won't spread in America, that our amazing healthcare is going to knock it out, and in all the other countries, that even if it does spread, there won't be many deaths, so we can just go back to work or play or whatever. That's, all right, the cases are rising, but the deaths aren't rising, so it's fine. And everything that every prediction like this that's happened so far has been wrong, completely wrong in a way that's killed people. And I don't know, I don't want that on my conscience. I don't know who would, but I just think that there are things that people want to do that keep getting in the way of the things that they should do, and without this feeling that we're all a community working together towards something, I think it's quite easy to pursue your own goals to the detriment of others. In this case, to whatever, go to that party, to hang out in the restaurant without a mask on, to go to the bar, whatever else, which it may or may not directly affect you right now, but that's the behavior that also encourages others to do the same stuff. And statistically, it is going to lead to more cases, more suffering, more bad things for more people, including people that you care about eventually, if you care about anybody. So, yeah. I don't know. Anyway, answer to your question is, that's basically what we need to do. A ton of testing, and we need to get together. We need, I don't know, the sort of ground up leadership with individuals saying we need to do things, which is basically what I'm doing, hasn't really got us much of anywhere. It's kind of like being the prophet Cassandra from whichever Greek play that was. And in that, you can be right, and you won't be heard, and people won't follow your advice anyway. That's kind of how it feels right now. And I don't know. I'm going to keep trying still, because I think it's the right thing to do. But it makes me very sad every time I hear something like this. Somebody saying that we're going to get out of this, it's going to be fine, just keep doing what you want, it'll all be okay. Because that's not how the virus works. And you can't predict that, and people have predicted that before, and they've always been wrong. That doesn't help anybody. Making predictions that are comforting but wrong in a way that hurts people doesn't help anything. It just leads to more suffering for more people, and I don't want to see that. Anyway, that's enough of that. For today. But thanks very much, Amy. There's the answer to your question. At least in the best of my professional judgment. Thanks very much. This has been Ask Dr. Ben.